Hello, this is Rachel Morelli presenting my scholarly project titled Reducing Stress in Registered Nurses Within an Online Nursing Community Using an Emotional Intelligence Educational Module. Please allow me to introduce my committee members, which include Dr. Rita Wunderlich as my project chairperson, Dr. Lisa Staurer as my second reader, and Dr. Kimberly Probus as my community member. Nurses are experiencing stress at alarming rates. This stress can negatively impact the nurse, the patient, the organization, and the profession. Emotional intelligence, or EI, is an evidence-based tool used to combat the effects of stress on the nurse. This quality improvement project aimed to study the effect of emotional intelligence on the registered nurse, or RN, using a pre-post cohort study design to obtain the self-perceived levels of stress of the nurse. Self-perceived stress levels were measured by the Perceived Stress Scale 10 items, also known as the PSS-10. The data collected was analyzed using descriptive statistics, which revealed no statistically significant differences between the two study groups, and further research of EI's effect on the nurse is indicated. Stress is defined by the American Psychological Association as a normal reaction to everyday pressures, but can become unhealthy when it upsets your day-to-day functioning. Stress is a normal part of life, but can become pathological when the perceived stress exceeds the self-perceived ability to cope with it. Nurses of all areas of the healthcare industry globally are reporting increased experiences of stress. On average, between 18 and 50.8% of nurses surveyed throughout the literature reported experiencing stress. 45.3% reported having at least one mental health disorder. Physical and mental health disorders due to work-related stress are increasing, placing mental disorders among the top 10 professional diseases in the U.S. Persistent stress in the nurse can result in psychological illnesses such as anxiety and depression, and physical illnesses including heart disease, high blood pressure, and diabetes. The effects of stress on the nurse are characterized by poor concentration and poor time management, decreased response to crises, frequent mistakes or medical errors, having a reduced ability to perform mental tasks and emotional exhaustion, reclusiveness and depersonalization, having poor interpersonal skills, being prone to temperament issues, and exhibiting signs of burnout. Negative implications for the patient include compromised patient safety and patient outcomes, including mortality. Stress in the nurse reduces empathy and sensitization to the patient's needs. Stress also profoundly affects the organization. Nurses who experience stress have an increased number of missed work days, increased occurrence of workplace injuries, place a significant financial burden upon the employer, and are less adaptable to changes within the workplace and have impaired interpersonal relationships within the organization. The impact of stress on the nursing profession has not gone unnoticed. Nurses are leaving the profession, retiring, or not entering the profession. The national average for turnover is 8.8 to 37%, with the primary reasons cited for nurse turnover being nurse stress and job dissatisfaction. The economic cost of turnover ranges between $22,000 and $88,000 per nurse. With nurses comprising the largest sector of the healthcare industry globally, staff and profession retention rates have become a prominent concern, as the U.S. alone estimates an additional 275,000 nurses are needed between the years 2020 and 2030. The non-economic costs include patient falls, facility-acquired pressure wounds, medical errors, medication errors, and increased length of stay. The compilation of these negative implications commands the implementation of strategies that are aimed at mitigating the effects of and reducing stress in the registered nurse. EI is an evidence-based method of reducing nurse stress. Emotional intelligence consists of 4 skills, creating 2 primary constructs of personal and social competence. Self-awareness and self-management skills form personal competence that focuses on oneself and is the ability to be cognizant of one's emotions and manage one's behaviors. Social awareness and relationship management skills forms social competence that focuses on one's ability to understand other people's moods, behaviors, and motives to improve the quality of these relationships. Bradbury and Graves, 2009, state that EI affects how behaviors are managed, how social and contentious situations are handled, and how personal decision-making influences outcomes. EI training can improve self-awareness, enhance self-management, develop social awareness, and acquire relationship management skills. Nurses with increased EI have lower self-perceived stress levels. The aim of this scholarly project was to study the effect of emotional intelligence on registered nurses' self-perceived stress levels in order to answer the research question guiding this project, which is, in nurses within an online nursing community, does an emotional intelligence intervention as compared to no intervention reduce scores on the perceived stress scale 10 pre as compared to post-intervention? A literature review was performed where 4 common themes emerged from the 12 articles included in the review. The first was factors contributing to stress in the nurse. The most recurrent factors cited as contributing to stress in a nurse fell under the categories of work environment, nurse responsibilities, or organizational influences. The most cited contributor of stress in the nurse is continual exposure to stress within the work environment. Conflicts with colleagues, patients, or doctors were the second most cited reason. Overworking, shift work, nursing shortages, types of responsibilities, and nature of work, along with lack of autonomy and time to complete work, lack of mental support and recognition for positive outcomes were also listed as contributors to stress in the nurse. The second theme was adverse effects of stress on the nurse. The implications of stress can adversely affect the nurse, the patient, the organization, and the profession. Prolonged stress can cause health disorders in the nurse, psychological disorders, fatigue and burnout, dissatisfaction, and substance abuse disorders, in addition to social consequences for the nurse. Effects on the patient include a reduced quality of care being provided, delays in care, compromised patient safety, increased errors and near misses. Stress in the nurse affects the organization, whereby the nurse has a reduced adaptability to the work environment, a decreased ability to make accurate and prompt decisions, a reduction in the nurse's response time to crises, incorrect or incomplete nurse documentation, increased absenteeism, staff turnover, and conflict, including violence within the workplace. Additionally, the nursing profession is affected by nurses exiting the profession rapidly or not entering the profession at all. The third theme was emotional intelligence effects on stress on the nurse. The literature reflects an inverse relationship between EI and self-perceived stress levels. EI assists the nurse with managing and controlling their emotions, which improves their overall well-being and outlook, decreases and buffers occupational stress in the nurse, reduces complications related to stress, protects against emotional exhaustion and burnout, and improves social skills. The benefits of EI on nurses, on the patients, include improved inpatient experiences, greater empathy and attention shown to the patient, improved patient outcomes, an increase in the quality of care provided to the patient, and improved patient safety. The effects of EI and the nurse on the organization include reduced workplace stress, better performance and greater competency, increased productivity, lower rates of turnover, increased job satisfaction, greater adaptability in the workplace to ideas and strategies, improved decision-making skills and critical thinking, and lastly, proficient conflict resolution skills. And the last theme to emerge was the tools used to assess self-perceived levels of stress in the nurse. The ability to accurately quantify the self-perceived levels of stress is critical in order to measure the effectiveness of any intervention that's implemented. The self-questionnaires to measure self-perceived stress levels in the nurse included Godzilla's inventory, the modified mini-COPE questionnaire, the workplace stress survey, the hospital job stress standard questionnaire, the job stress questionnaire of UK Health and Safety Executive, the perceived stress questionnaire, the nursing stress scale, and the perceived stress scale. Lazarus and Falkman's transactional model of stress and coping is the theoretical framework that guided this doctoral project. Lazarus and Folkman's 1984 theory describes stress as the relationship or transaction between the person and their environment, with stress being a response brought on by a stimulus that is perceived as dangerous or threatening, eliciting a stressful behavior or physiological response. According to the transactional model of stress and coping, a cognitive appraisal is the first step of the process and is a subjective response whereby the individual evaluates their relationship with the environment to determine if a threat exists. If a threat is detected, the second step entails the individual to assess their ability to meet the demands of the stress and their ability to overcome or cope with it. This theoretical model was chosen to undergird this project because the experience of stress is subjective and the appraisal of that stress and ability to overcome and cope with it are unique to the individual experiencing it. The framework undergirding the intervention is Salovey and Mayer's 1990 Emotional Intelligence Framework. When placed in the context of the transactional model of stress and coping, the first appraisal involves performing an accurate appraisal and emotion in the self and then in others. The second appraisal involves the successful ability to regulate the emotions in self and then the emotions in others. This project was conducted within an online community of nurses in the Facebook group Nurses Helping Nursing Students between September and November 2023, whereby eligible candidates were forwarded to an anonymous and secure Qualtrics platform to complete all surveys. The group consists of nurses and nursing students as part of its vetting procedure. As part of the project construct, only RNs or APRNs were invited to participate in this study. Other inclusion criteria required the participant to be 18 years of age or older, a vetted member of the Facebook group Nurses Helping Nursing Students, and consent to participate. The post-intervention inclusion criteria required completion of the EI intervention in addition to the pre-intervention criterion. This quality improvement project used a pre-post cohort study design. This study's recruitment was conducted through the Facebook group wall with an accompanying flyer once a week for 3 consecutive weeks. The same process was utilized for post-EI participant recruitment to invite the pre-intervention participants. Once eligible participants were recruited, they were anonymously directed via hyperlink or QR code to a secure Qualtrics site. After eligibility criteria and consents to participate were confirmed, the participant was asked to complete a demographic survey, the pre-intervention PSS-10 survey, and lastly, the EI educational module. 1 month later, pre-EI participants were invited to complete the post-EI intervention PSS-10 survey on a dedicated Qualtrics platform page. Primary data collected in this research study was the participants' self-reported levels of stress using the PSS-10. The PSS-10 was developed by Cohen et al. In 1983 and is the most widely used psychological instrument to measure self-perceived stress levels. This self-reported 10-point Likert type scale requires users to report emotions over the past month containing 5 possible scaled responses that range from never to very often. The PSS-10 exhibits significant validity and reliability with alphas ranging from 0.74 to 0.91 and Cronbach's alpha of 0.865 and 0.796. The RN participants were asked to complete the initial PSS-10 survey prior to completing the EI educational module and were invited to take the post-intervention survey 1 month later. Once completed, the surveys were scored with a possible 0 to 40 points, indicating the level of self-perceived stress experienced by each participant. After scores were calculated, the participant's overall score was placed in one of 3 potential categories: 0 to 13, indicating a low level of stress, 14 to 26, a moderate level of stress, and 27 to 40, a high level of stress. Collective pre- and post-intervention scores were compared to determine if a change in scores was present. Secondary demographic data was obtained in the course of this research study. This demographic data was collected from study participants before completing the pre-intervention PSS-10 survey and EI intervention. The demographic information collected measured the variables that included the participants' age, gender, type of professional setting, and length of employment. This coded demographic data collection tool was developed by this researcher and has not yet been evaluated for validity and reliability. Data was recorded using the Qualtrics platform. Once completed, the data was downloaded to an Excel spreadsheet and uploaded to SPSS for analysis. Demographic data and PSS-10 survey results use the measure of frequency type of descriptive statistics to determine the frequency and percentages of the distributions. Variability and standard deviation indexes were created to reflect any differences in distribution. The range and standard deviation in this project sample reflect a relatively normal distribution. Having provided ordinal data, the PSS-10 survey results utilized the median value of the group to determine the central tendency. The pre-EI intervention group's median was 21.5. The post-EI interventions group median was 12. As mentioned previously, the median of the pre-EI intervention group was 21.5 and the post-EI intervention of 12, reflecting a moderate and low level of stress respectively. Here we have the distribution of percentages of each of the three potential categories of low, moderate, and high levels of self-perceptions of stress per group. The demographic survey results reflect the most significant levels of stress pre-intervention were reported by females ages 18 to 25 who work in acute care with a length of employment of 1 to 5 years, followed by moderately stressed in females ages 26 to 35 who worked in acute care setting with a length of employment of 1 to 5 years, and the lowest level in females ages 36 to 45 who worked in primary care or other setting for 10 or more years. Limitation in a research study represent weaknesses that could impact outcomes and interpretation of the research findings. There were several limitations identified within this study that related to its study design or the population that affected the generalizability of this research study. Firstly, the participants were recruited using convenient sampling from one Facebook group, which can impact the population's representativeness. Secondly, it was estimated that this project required approximately 41 participants completing both pre- and post-intervention surveys to yield adequate power necessary to represent the population effectively. This project had a small sample size with 32 respondents for the pre-intervention phase and 6 for the post. This impacted the ability to conduct inferential statistics, eliminating the possibility to identify significant differences between groups. Next, confounding variables of internal factors affecting the nurse's ability to cope and extraneous factors such as if the nurse was a contractual employee or not could contribute to a skewing of results, oversimplifying findings, and further decrease generalizability. Lastly, self-reporting and online questionnaires can threaten scale validity. Stress in nursing is not a novel concept. Stress has been a concern for nurses for decades and especially since the COVID-19 pandemic. Ongoing research has aimed to identify methods of effectively coping with this stress. The literature review showed an inverse relationship existed between EI and self-perceived levels of stress in the nurse. It was also the expectation that this research study would reflect comparable results to the literature reviewed and reveal an inverse relationship between EI and nurse stress levels. The pre-EI intervention median score was 21.5, indicating a moderate amount of stress. The post-EI intervention score 12, indicating a low amount of stress. This study failed to produce sufficient evidence to conclude a direct correlation between EI and nurse stress. The primary findings of this project suggest comparable results to research studies demonstrating EI's ability to decrease and buffer occupational stress in the nurse and to improve the nurse's ability to overcome and cope with stressful situations. Secondary findings are consistent with studies suggesting that acute care nurses experience moderate to severe levels of job-related stress. With nurses comprising the largest sector of the healthcare industry worldwide and the primary discipline responsible for patient care, buffering nurses' stress to prevent negative implications while promoting interventions to yield positive results becomes crucial for nursing practice, healthcare policy, and the quality of care and patient safety. Nurses with EI can better adapt to their work environment, manage chaotic environments, improve thought processes, make critical decisions, establish good social relationships, reduce the risk of occupational stress, and provide nursing care in accordance with Nurse Practice Acts. Nagel et al. 2023 stated that between 2020 and 2021, 50% of nurses contemplated leaving their job, and 47% of those intent on leaving cited work-related factors negatively impacting and affecting their health and well-being. Nagel 2023 presupposes that there is a need for increased stewardship and governance in nursing to demonstrate the link between active engagement, increased productivity, and reduced stress and nurse burnout. The evidence shows that EI decreases workplace stress in the nurse, improves the nurse performance and productivity, reduces nurse turnover and improves job satisfaction, is more adaptable and flexible to change, increases resilience, and improves interpersonal relationships. The implications of reducing stress in the nurse are critical to ensuring that quality, safe care is being delivered to the patient. EI in the nurse has revealed improved patient experiences, more empathy displayed by the nurse and more attention to be placed upon the patient, improved patient outcomes, an increase in the quality of care provided to the patient, and an overall improvement to patient safety. Stress has been cited as the greatest under-addressed concern facing nurses and an antecedent to nurse illness, poor patient outcomes, increased organizational turnover and expense, and reduced nursing profession retention. Emotional intelligence is an evidence-based practice used to effectively mitigate stress in the nurse. This scholarly quality improvement project, implemented within an online community of nurses, sought to answer the research question guiding this project to determine if an EI educational module effectively reduced self-perceived stress levels in the RN. The results of this research study reflected a pre-intervention median score of 21.5, which indicated a moderate level of stress, and a post-intervention median score of 12, indicating a low level of stress experienced by nurse participants. Descriptive statistics were utilized to analyze the data. While the data did not show a statistical difference between the two groups, it suggested that EI module may effectively reduce stress in the RN within this population, and implied that further research is indicated to explore the effects of EI in buffering nurses' self-perceived stress levels. Stress is an ongoing concern for the nursing profession despite our best efforts to combat that stress. While contributing to the wealth of knowledge related to using EI to mitigate the effects of stress on the nurse, this doctoral project lends itself to the importance of continuing to expand this research and interventions to address nurse stress to prevent irreparable harm to the nurse, the patient, the organization, and the profession. This can be accomplished through studies that have a longitudinal design structure so that participants are followed over a longer period of time. Next is to focus on recruiting a greater number of participants to have larger sample sizes and a higher probability of attaining more male participants. Finally, include an evidence-based emotional intelligence measurement tool to accurately assess the level of EI in the nurse pre- and post-intervention to better understand the effects of the intervention, as well as any confounding variables that may be present. For questions, comments, or concerns, please contact me at rmorelli1@live.maryville.edu. Thank you for viewing my doctoral presentation on reducing stress in registered nurses within an online nursing community using an emotional intelligence educational module.